My name is Jeffrey John. I'm a physical therapist based here in Luxembourg, Western Europe. I heard about Whelton Methods on LinkedIn. I came across a video of Dr. Ryan Whelton talking about how he found off switches to most musculoskeletal pain problems. And I got curious and I decided to check out his site to see what he has. And from there, one thing led to the other. I ended up on the YouTube channel where I saw actually his demonstrations of these methods of, getting rid of pain, either neurological pain or musculoskeletal pain. So yeah, I got sold. I decided to try one of his courses. I took first the introductory shoulder course, and I was able to use it the next day. So it was mind blowing to see that I was able to change instantly someone's pain from about a level of about 7 out of 10 to 1-ish, or, it's kind of, I don't know if I have a pain or not. So it was really, really, really interesting for me. So because of that, I found it very interesting. I decided to go back to the site to see what other courses he had. And here I am. I ended up taking all the courses. I've been able to incorporate these things into my practice, and it just blew up my entire private practice, to be honest with you. I used to have about 70-75% success rates because I also use other kinds of manual therapy methods like Milligan method. I do a lot of manual therapy, so I get people out of pain, but it takes a while. I do ultrasound. I used to do ultrasound, I do TENS and all that, but ever since I found Dr. Ryan Whelton's methods, it's been like easy peasy. So the things I used to get done in a week, I get them done in 2 days, and that's really a big plus. Plus, people are fascinated that you have a shoulder pain, I touch somewhere else, and the pain goes away. So that's something that people find very fascinating, and they keep bringing more and more people. So that I have people that have treated the mom, the dad, the kid, and the neighbors, and people just keep coming. And it's not just about here in Luxembourg. I have people coming from across the border because we are right in the middle of Western Europe. So you've got France, Belgium, Germany, and Netherlands on the other end. I had one person actually who is planning to come from Arnhem in Netherlands. That's about 380 kilometers away from here, because someone told him that if he has frozen shoulder, he should go to me because I use an interesting method that gets rid of the pain instantly, or at least over 2 or 3 sessions for such a big thing as frozen shoulder, and that he will be able to recover in a month. And because of that, the guy is planning his trip. He's making reservations. He's going to drive down to this place just for this treatment. So, yeah, what can I say? I would say thank you to Dr. Whelton, and thank you for deciding to share this with people there. So there might be other people also with solutions, who knows? But he is nice enough and very kind enough to, share with the rest of us so that we can help people. And to mention one more thing, the sacroiliac joint protocol that he put together, that's actually the one I use the most of all the courses. That's the one I use the most. And yeah, I've been able to get my neighbors, people from far away, MDs, general practitioners, psychologists, name it. Everyone, what profession, airplane mechanic, just name it's too much. The number of the kind of people who come here from wherever. There are people who drive at least 70 kilometers each time. That's it's not a big deal because there are so many people doing that. But yeah, people come from all over the place to see me. That doesn't mean I'm the only physical therapist in Luxembourg, but people who are looking for real solutions, who've had problems for years, come to me because somehow, with the methods and with the well put together exercises in the rehab result course that I also took from Dr. Ryan Whelton, you're able to get people better within a month, or maximum, 6 weeks or 7 weeks maximum. And it worked for me. My official method worked always for me. SI joint protocol works all the time, actually, for me. So unless I don't diagnose it well, which is not the case in this right now, because after learning from Dr. Iwan, I'm able to get every single SI joint diagnosis correctly, irrespective of the pain referral pattern. So this is something I would encourage other physical therapists to try. Initially you might seem a bit skeptical. Don't worry, you're not more skeptical than I am as a person. But if I could, decide to try it, maybe you should give it a try and see. And believe me, it won't change your practice forever. It'll change your private practice forever. And